Shalini Bharat. I'm Director, Vice Chancellor at the Tata Institute of Social Sciences, Mumbai. First of all, let me just say that, if you remember, SDG 17 is about collaborations, partnerships. And I think in healthcare, more than in anywhere, collaborations and partnerships matter because today all of us probably complement each other's, you know, uh, each other's characteristics or competencies, and the problems are so unique, so complex that one size fits all will not do. Similarly, one solution also will not, bring the kind of desired results, and therefore we need to bring multiple partners onto the same platform. The other issue that requires us to be, bringing partners is that we have recognized that most issues, including all the diseases, have a, not just a biomedical, side to it, but a non-biomedical side to it, which means that when we bring social dimensions, these are multidisciplinary and require interdisciplinary focus, and along with medical approach, we need to work in teams, and therefore I think it's very, very important, critical today to work in multidisciplinary teams and work in a collaborative way. So if we look at, the TB issue, we recognize today that despite treatment being available, we have not been able to, control TB as a problem in the country. In fact, India has, almost 1/4 of the, world's TB burden. And that's because we have only seen in the last several years, we have seen this only as a biomedical problem. Now, increasingly, we have realized that we need to understand that people have multiple issues before they had TB or as a result of TB. That they have this problem, but they also fall into, they lose employment at times, they fall into the poverty bracket, there is a huge stigma around the disease. Then there is a gender dimension that, men have different consequences, but women experience and face different other consequences. There's a great deal of need for counseling to be here, and that counseling is not just about taking care of the psychosocial, issues, but also linking them to health services, to other government schemes, and so on. And all this requires that we work alongside, biomedical providers, but then there are those who can provide the kind of psychosocial care. We also need to bring community leaders. We also need to bring peer group members, that is, those who have survived, TB, and they become champions of, and they also provide peer-based counseling. So this is one great example, and this is happening now in India. From our own example, we know that, as an academic institution, we are providing support to the government, that is the Central TB Division, in the form of providing trained psychosocial counselors, training for them, and be able to look at drug-resistant TB as one of the issues. In 4, states, we are providing psychosocial care and counseling to drug-resistant TB cases. In addition to that, we are also finding that we have public-private, providers also collaborating in TB care. The Tata Institute of Social Sciences is, I would say, a community-engaged university and India's premier social science university. We have 4 campuses in Mumbai, Hyderabad, Tuljapur, which is a rural, based campus, and one in Guwahati in the northeast. So this institute started as a institute for professional training of social workers, but in the last several years, we have more than 50 PG programs. We have 4 robust UG programs and 18 PhD programs, and I think this is one of the only university which has applied social science as its focus, and we have almost about 7,000 students at this point in time, along with the School of Vocational Education. So a very multidisciplinary social science university.